Now, once a case is confirmed, there is a coordinated effort to retrace the patient's steps.
That way, officials can quickly identify who else may have been exposed. CBS 2's Aundrea Cline-Thomas outlines the process for us. She is at Columbia Presbyterian in Upper Manhattan tonight. Aundrea.
Maurice and Christine, the 50-year-old, remains here in serious condition. The first step was the positive diagnosis. Now the widespread investigation begins. Providing the best medical care is a first priority after a positive coronavirus diagnosis. Then the health commissioner is called. In this case, it was 1 o'clock in the morning.
As soon as we're notified, our role is to start investigating, to start interviewing every person that we can who might have information.
The goal is to find out how the patient contracted the virus and who else may be exposed, starting with testing the patient's family, and in this case, employees at the Manhattan law firm where he worked.
In the case of the small law firm, there are 7 people who work at the firm who have been identified by the Department of Health as worthy of follow-up. That testing will proceed. Others who did not have that direct contact have been given, broad precautions and guidance.
The results may cast an even wider net that will take days to identify. Those who test positive are quarantined. For now, the focus is on those who have regular and prolonged contact with the patients, perhaps sharing an office space, not those who share public spaces in passing.
Subway's not our problem right now. Home is our problem.
The unidentified man in this case did not travel overseas to areas where the coronavirus is more prevalent. For now, it's believed this is a result of what's being called a community spread, which reinforces the need for the public to take precautions.
Hand washing is the #1 thing that I can tell you. It is the most important thing that you and your family can do at the moment to protect yourself.
Health officials are learning more each day about the coronavirus as they prepare for it to spread. There's a push to diagnose cases even earlier as local leaders join healthcare professionals in trying to prevent an outbreak. And if you believe that you have been exposed to the coronavirus, it usually presents like flu-like symptoms. Health officials stress don't just show up to an emergency room or an urgent care facility. Instead, call ahead. That way the medical staff can take the necessary precautions. Reporting live in Washington Heights, Aundrea Cline-Thomas, CBS 2 News.
Good information, Aundrea. Thank you. And if you think you've got symptoms of coronavirus or have questions, hotlines have been established. In New York, you can call this number, 1-888-364-3065. And in New Jersey, the number to call is 1-800-222-1222.